I think there are a lot of emerging threats to cardiovascular health. Of course, some things are identified, things like diabetes, and it's remarkable the advances that have occurred in terms of diabetes drugs that have cardiovascular benefits. It's just been incredible experience being part of some of those trials and seeing other ones unfold. So that's not to say that the war on diabetes is over. Diabetes, at least on a global level, is certainly increasing. Obesity is another potential risk factor, again, worldwide, something that's increasing. Smoking, it depends. Rates have stabilized in the United States, but in other regions of the world are still increasing. So that's still an important cardiovascular risk factor. In the US, of course, vaping has really taken off, more so among young people. And that's a potential threat for years to come. There's a high rate of vaping, it appears, in high school age students. And there's still nicotine with its addictive potential in those different products. And they also come with flavorings, which itself can get someone that's young hooked on them. So there's potential concerns there, and at least some preliminary data emerging that vaping isn't safe and carries cardiovascular risks as well. So maybe 20 years from now, we'll be looking back and saying, why didn't we do something more to curb the vaping epidemic? I wouldn't be surprised if that happens. Another sort of risk factor that's emerging is pollution. That is a greater appreciation that pollution of any sort, air pollution, noise pollution, but I'm really referring to air pollution, seems to be associated with excess cardiovascular risk. And that's a problem globally. It's actually more of a problem outside the US than in the US, in particular places like China and India, where the rates of air pollution 5-fold or more higher than the US. I think it's a potent risk factor for cardiovascular disease. There's epidemics of cardiovascular disease occurring there already, but I think air pollution will further fuel that. So while we've made a lot of progress in terms of things like diabetes medicines, lipid-lowering therapy, now I might even say triglyceride-lowering therapy, lots of different things that the medical community and scientific community can be proud of and happy about, I think there's still a lot of room for cardiovascular risk reduction both in the United States and globally.